Hi, my name is Kelsey and I am a Dona doula and Lamaze childbirth educator. I grew up in Tennessee and Alabama, where access to reproductive health care was kind of limited and reproductive education was basically abstinence only education. Um, Included in that fact, a lot of my friends had babies between the ages of 16 and 19, and none of us knew what we were doing. So I was the person who was there with them at their WIC appointments. I went to their prenatal appointments with them. I went to their ultrasound visits, and I was there at the birth of their babies. I did not know at the time that what I was doing was being a doula. But I knew that being part of a person's laboring journey, their birthing journey, was something that I was really passionate about. And I thought that doing sex education or doing reproductive health education was what I wanted to do to help support people. So I went to college and I got a degree in psychology, a minor's in public health, and then decided to get a master's degree in public health from Boston University. And there at Boston University, I was doing some really awesome research about VBACs or vaginal birth after cesarean section with some midwives. And those midwives were like, hey, Kelsey, we have an in house doula program at this hospital. Would you like to come and be a part of that? And I, of course, jumped on the opportunity because I loved the experience of my friends' labors and births and wanted to be able to learn more and see more about it. So one day I went into the hospital and got to observe a doula working in her role and then got to do some births myself. And through that process, I was like, wow, the research is super important. It's good that we get this information out, but I want to be part of the change in the room, in the moment for each individual person who is having babies. I want to be part of that experience, that interpersonal experience, and not so macro level. I wanted to be in the room with people. So I finished my graduate degree and I moved back to DC and I did a doula training and I've been working with DC birth doulas ever since. It's my goal as your doula to help you feel like you have all of the information that you need to be able to make the best decisions for yourself in your birth. Every birth is different, and each one of them is challenging and different in various ways. I've never been to a birth that's exactly the same as another birth that I've been to in the past. And I want to be there as your doula to help you navigate those changes that you're going to need to make so that at the end of it, you feel confident and comfortable going into the parenting journey. I also really care passionately about reproductive health care and birth justice for women who look like me, for black women in the United States. I think that doulas are part of the change to improve black birthing outcomes and making things different for black birthing people in this country. And so I really wanted to do something involved with that too. And being a doula allows me to be able to do that, not only on the ground, but being involved with advocacy and policy work in that area too. I'm really excited to hopefully get to know you guys too and look forward to working with you in the future. Bye.